right. Our guest today is Dr. Brett Beber, plastic and reconstructive surgeon, private practice in Toronto, and chief of the division of plastic surgery at Michael Garron Hospital. Quite a resume. Yeah, very accomplished. That's why I had to read it. I could not remember that.
And also not on script, the most lol person on the planet. I just got to know this gentleman, this fine gentleman. Yes, he's all of those things, but we also just got to know each other very well in Saint-Tropez when we were away for Lauren's 40th. We talked about it a little bit. It was a very eclectic mix. Like, I know all of Lauren's friends, but like I didn't, you know, like we never hung out before, right?
Mm-hmm.
Well, traveling with people is a different story, as we know.
Right. So it was just so fun. And like, I feel like I was just the jokes that we had and it was just really great to get to, you know, even you and your wife, it's so funny because some people are, you know, this one way in all aspects of life. And I really, you know, admire it. These two in different dynamics, they just turn it up on different levels. And I love that.
Yeah. Brett's like, don't say anything.
No. Okay,
For those of you who don't know, Brett is married to Dr. Tony Zong, who is, you guys are a power
It's a
couple.
dynamic that I've never seen before. That's what I mean. They're chameleons in the best way possible. Like they run Toronto in the medical scene and then they just go off on these funny trips and like, I don't know, have a really good time.
Yeah.
What do you guys say? Choose adventure.
Choose adventure. Yeah.
Choose adventure.
Yeah.
You
We
guys
were
have
just
that
in
tattoo?
Montana. Yeah. We were just in Montana together. And Brett is also a cowboy. For those of you who don't know, he adapted, like, he's one of those people who just, you are good at everything. And it would be it would be frustrating.
But the boots and hats were fun.
The boots and hats, you really, I want to say got into character, but it didn't even feel like character for you. It just felt like an extension of your natural self.
Yeah, like you see him walking to drop off.
Well, I was expecting him to show up in a cowboy hat
He's got
today.
two outfits. He's either in scrubs. You don't know what version you're going to get.
Scrubs or cowboy boots. Okay, but let's get started. We have so much to cover. I think
This is a very, very hot topic because
so many hot topics.
yeah, well, and this one specifically, because like these are like everyone wants to know the shit about this. And like everyone hears stuff from a friend or this or that. You can read what you want online or in magazines, but we have the source today. You know? The source. So like this is like, I don't know. I feel like there'll also be a lot of like questions after the fact. So you'll have to be on the DMs.
I'll be answering those. Okay, but we're gonna talk about surgical procedures first, and then maybe get into the more non-invasive things that you do at your clinic. But I think what you are known for, or like the thing that you do the most, is breast and tummy. Is that right?
Yep.
And are you? Would you say you're known for the mommy makeover in Toronto?
I think so. I mean, it's, you know, mommy makeover is a catch-all term, right? So we use it to describe improving the changes that occur after pregnancy, but it's not just after pregnancy. It's also, we see it in our weight loss patients, right? So it's changes to the breast where, and the breast is more of the, there's different things you can do. So for some people, they're happy with the size of their breast, but things have fallen over time. So they may just want to lift.
Yeah.
Whereas other
You know
people,
that. Yep.
whereas other people, their breasts got a lot smaller after pregnancy or breastfeeding. And so they're looking to regain the volume maybe that they had before, sometimes go beyond that if it was something that they wanted to do. But the idea is that with them, they want to add volume. And then there's others who are the opposite, where their breasts got bigger during pregnancy and after kids, they never went down. And so they're often looking for a lift and a reduction. So when it comes to the breast, there's lots of different sort of situations that can present. And for the abdomen, usually it's a tummy tuck. And there's variations of, there's mini tummy tucks and full tummy tucks and things like that. But usually the tummy tuck is always part of the mommy makeover. And then the breast surgery can vary depending on what the situation is.
Tummy tucks are crazy to me.
Yes.
Because I don't know, only time I've ever seen them, is it like with the modern technology, it's just scarring still kind of the same deal. Like you cannot get around that kind of hip to hip incision.
It's one of the limitations of the surgery that because it's not just removing something from inside. So for instance, liposuction, right?
Yeah.
You can do liposuction through a 4 millimeter port incision, and you may need a few of them depending on the number of areas that you're doing. But what you're doing is you're going inside and removing the fat, but leaving all the skin.
Okay.
With a tummy tuck, you're doing the tummy tuck and not just lipo. You often combine it, but you're doing that incision because the problem is the skin, or at least part of it. And the only way to remove that skin is to cut it out. And anytime you cut out skin, you're going to end up with a scar.
So would you say then like is the better candidate someone then who's already had like a C-section if they're coming in and they already have that scar?
It's an easier choice for them, I would say. They may not
you
be.
can just go right at the same type of scar, I guess, like
So
in the area.
good question. So often we go lower because
Okay.
it depends on where that C-section scar is. If the C-section scar was made pretty high, then we can often go lower than that and take out that old scar. But typically the incision itself would be longer than a C-section. I mean,
Right.
sometimes you see a
That's good,
C-section.
though. And if you already have it, then why not? But it's just one
Yeah.
of those things. And there's so much you can do now, with scarring too, right? Like
Correct.
I just even know, like, there's just all from ointments to lasers to everything, right? To just help reduce that. So
Yeah.
the belly button also can look pretty creepy
Well, that's
because you have to
You've gotta
recreate
move
it,
the-
right?
yeah.
Well, so there's different ways you can manage
Yeah.
it, but the most typical is that you're leaving the original belly button where it is.
Okay.
You're making an incision around it. So it stays attached below, but now the skin around it is released.
Oh,
So now the skin's been
Mm.
lifted up. And so when the skin is up, you see a hole in the skin that you've lifted up.
yeah.
But by the time you've pulled everything down, that opening of where the belly button was is now below the
in a
scar. So
different
it
spot.
goes out. So then when you first close, there's no belly button there.
Right.
And
so
then
that's
you
not.
you make a
Make a
new
new one.
opening and the original belly button pulls through like a button through the slit in your,
And you can make it look very
Very-
natural.
Yes, and there's different ways to do it, and I do it in a way that actually helps hide a significant portion of the scar inside the belly button. Which,
like a little tucky tuck.
well, it's you're changing instead of being a circle, which is really obvious.
Yeah.
It's more what you see from the front. It's almost like an upside down horseshoe, and the rest of the scar is inside. Because when you look down at your belly button, what you see is the skin of the lower abdomen rolling up into the belly button, right? There's a curve. There's no line there.
Right.
So I use part of the skin from the abdomen when the belly button's coming out and roll that in. So when you look down, it looks like a natural roll.
Is that a Brett Beber technique?
No, I've sort of modified things, but I didn't invent it.
Yo,
That's BB copyrighted.
That sounds like it should be. Damn. I was like really into deep visualization there. You know what I mean? When you were doing that, I was like, that's so cool that you do that also
Yeah.
every day.
And how do you make it? Because I also find sometimes with tummy tucks, it's like, it's almost so flat sometimes where like it's like you can't see the abdomen almost. Is
Right.
that still
So
part of it?
So typically the tissues that you're looking at modifying are, if you think of it from the outside in, there's the skin. So we want to remove the extra skin. We also, if the subcutaneous fat, so the fat that's not inside the belly, because we can't change that, but the fat that sits underneath the skin, if you look at that skin, it's sort of like at a birthday cake. There's icing on the top, which is the skin, but then underneath there's 2 layers of fat, just like a birthday cake with sort of icing between the 2 layers. You don't want to touch the stuff that's just under the skin because that's where all the blood vessels run for the skin. But the second layer, the deeper layer, that you can remove. So we often, if there's enough sort of fat in that area that taking it out is going to make a visible difference, then I'll liposuction that. But the fat that's just under the skin, you have to leave behind.
Right.
But the third layer is the muscle, because often with pregnancy, the muscles like the 6-pack muscles, which normally sit about 1 centimeter apart, they're fused in the middle, and that's how we're born. And then there's a little space where the belly button comes out. But often with pregnancy, those 2 muscles will separate from each other.
Yes.
And in some women, they're very lucky and it just comes back. And people are like, I can't believe you had a kid. Like your belly's so flat, right? But for many women, that doesn't come back. And there's lots of exercises online showing.
Is that what diastasis?
Correct. That's called erectus diastasis. And there are some exercises that people suggest will improve that. I'm not so sure. It certainly strengthens. There's no downside to it. It strengthens the abdominal wall. It strengthens the rectus. But there's debate as to whether it actually pulls them back together. But in many cases, it doesn't, or people don't do exercises and it doesn't. But I think it's probably more Mother Nature than the exercises that it's going to happen or it's not. And so with surgery, the third layer that we manipulate is if there is that diastasis, then during the surgery, we pull that together.
Oh, so that's also why mommy makeover. If people have had the separation, you can bring it back in, tighten everything.
I don't love the mommy makeover title though.
Maybe you can rebrand it.
It feels a little dated to me. It feels
Yeah.
a little bit like, I don't know. It feels like I'll think of it.
Want something like a little bit
I
more
don't know, it feels
sophisticated?
just like,
Yeah.
Like it's also like you're more than just a mom. You're like, this is for you. It's your
Right.
body.
Yeah.
You
I
know,
get
like
that.
I kind of like feel like it is. And some people are doing it because of, I don't know.
Yeah.
I'll get there. I'll get there, Bieber. I'll get there. Give me a
Okay.
minute.
Just Lady's gonna rebrand the mommy
We'll
makeover.
brainstorm.
But full disclosure, so I actually came to you, and I'm totally fine to say this because after like having 4 kids, I have loose skin on my lower abdomen. All the working out, all the good eating, like it doesn't really matter, right? It's been stretched and pulled and it's there. So I came for a consult on a tummy tuck, but I had never had a C-section. And one of the
Right.
biggest things was the hip to hip scar.
Mhm.
And also because there is loose skin, but there's not so much, that basically how you explained it was when you pull it, you can't pull so far down. So the scar would actually sit not only hip to hip, but also quite high.
Oh, you didn't have enough fat in your fupa region.
Yeah.
Yeah. So
And-
you had to go up
well-
higher.
Thank you
Yeah.
for
No, but that's so then you would have a gnarly higher
a gnarly high. So
because you had like this much fat. No, but like just realistically, you had skin.
But her skin, like when you think about what a formal, like a full tummy tuck involves, it means that you need to have enough skin between your rib cage and your belly button that actually, when unfolded and pulled, will actually cover the whole abdomen.
Right.
Mhm.
Now you can do mini tummy tucks.
Okay.
So what that involves is just removing the lower skin. So if their primary issue is in the lower abdominal
Oops,
skin,
yeah.
then you can pull that down and you can make that scar as low as you want because you're not moving the belly button.
I think I have that problem. So do you.
But what did we say that why?
Your loose skin is above your belly
It's
button,
above.
but it's not a ton, and below your belly button, it's actually not very loose.
Oh,
So for that
I mean,
length
I
of,
don't know about that assessment, but
pull a little harder down low.
but that's
so
why
I was
you're-
not a great candidate for the
Right.
for the half tummy tuck.
right. And for you, you're sort of going through all the different options. You
Yeah.
said, listen, that scar isn't worth it to me
Worth
for the
it.
change.
Exactly,
Right.
it was not.
So
worth
what would
it.
then be something that she could do? So someone that might not want, I guess,
invasive surgery?
because we're talking about. We're going to jump around a little just
Yeah.
right now
Yeah.
because I think this is relevant for people that don't want the scar, that aren't a candidate, which is a lot of people. Let's like not everyone's getting a tummy tuck. What are some options that you can do in clinic that are to help? It's all of
Tighten
us.
the skin.
Tighten the skin.
Yeah.
Just feel a little bit more confident to work with what you got versus doing something super invasive.
And that's a lot of people. Like
Yeah.
not everyone.
100%.
And you get a lot of people who have that loose skin just above the belly button. It's sort of a bit crepey and a bit loose, but they don't want a scar there
Right,
because
yeah.
they're already dealing with that crepey skin, and a scar is going to look worse. So what are the things that we can do? For a long time, there wasn't a lot.
Yeah.
So lasers were the skin tightening mechanism, and that can leave depigmentation, and it wasn't great for large surface tightening without sort of a long prolonged healing and that type of thing. But now the technology has gotten so far advanced that now light-based therapies like lasers are less involved with that, but now we can target the deeper tissues. So there's ultrasound. So for instance, there's a machine called SoftWave, which is ultrasound targeted waves, and it's all about putting energy into the tissues to increase collagen production and actually create tightening. There's also radio frequency, which does sort of similar stuff. And now you can actually tune the signal so that it's targeting different levels of tissue.
Wow.
So let's say your skin's tight, but you've got, sort of surface issues and larger pore
Like
sizes.
scarring is
and-
different on everyone, right? Some people have
Correct.
surface level versus deep.
Exactly.
Okay,
So
yeah.
if that's the case, then you can actually use radio frequency as an ablative device where
Very
it does
cool.
It destroys.
it destroys that so that the skin reconstitutes with more collagen and better contours and appearance. But for a lot of people, the skin itself looks good. It's just that it's looser.
Loose,
So
right,
you
because
can-
there's two issues. There's the fat issue and then there's the tightening issue,
Correct.
right? And sometimes there's treatments that involve both of them and sometimes it doesn't. Like there's things that target fat, but then even like when I've lost weight, stomach, legs, like then you're left with that skin. And if you can't do an incision, what are you doing with that
right.
skin?
And everyone who's doing anything to try and remove fat,
Yeah.
whether it's liposuction,
Yeah.
so doing it surgically,
Yeah.
or some of the technologies that either heat up fat to destroy it or freeze fat to destroy it, they need to know that just like someone who loses weight, their skin doesn't get tighter.
Right.
Their skin may already be tight enough that it has enough elasticity that it's going to shrink back on its own. but it doesn't get tight because you took the fat out.
Right.
Where
So you need both.
so well,
some people
if
that's
your
what you're
skin is
looking to
already
target.
loose, then it's likely gonna either stay loose or get more loose if you're removing a significant amount of fat.
So I'm just curious because I feel like just to talk about some of the specific machines, then I think there's so much confusion around.
There was all the hype about the original one.
The Cool Sculpt.
Cool Sculpt,
There's
which is
Cool
now,
Sculpt.
1 second, with that is a big no-no based on what happened, that model that like it did
Linda
the reverse.
Evangelista.
So
course you would know the
it's a
fucking name.
I don't have Cool Sculpting, but it does work. Like there are patients who do well with it.
I mean, yeah, it's been around forever.
But there are patients where, and we don't know the sort of reason why these particular patients get this, but they'll get fat hypertrophy in the area that was treated. And can you fix it? There are things you can do to improve it. But you're right. There are.
But it's not like you could like do when you remove filler, it just like gets out. It's not like if that happens, then you're kind of stuck with that.
There's usually some residual changes that you can't get rid of. But
Also, isn't that the difference too between like that? The Cool Sculpt is using cold,
correct,
versus something like a Neo Sculpt, which is
using
heat.
heat.
Correct.
So
Heat is better.
I wouldn't say it's better because if you get a good result with the Cool Sculpting,
right.
then
I
you're
guess,
super happy.
With Cool Sculpt, I guess if you're I would not be willing to
Right.
take my chance with that. Like, what if they don't know you have a random protein and that's what's going to make you have excess fat in an area? So Cool Sculpt, whatever. Okay, so then there's also
the Neo Sculpt. I think is the one that I feel like most people know about and is like the hot one for stomach tightening.
Yeah, and there's lots of. I mean, the thing is, the companies will all try and differentiate themselves from each other, but the physics are sort of pretty similar. And so so you're right, there's the cold options and then there's the warm options, which heat up tissue to allow those fat cells to break down and then sort of get absorbed. So, but it depends on what your specific needs are. And so a lot of these are technician dependent, right? You can, in other words, the person who's actually doing the treatment can be an expert and to get really great results. And you can get people who aren't necessarily
That's actually a really good point,
That
because you
happened to
could
me.
walk in, right, and you could walk into the fanciest, place in whatever city, but if you don't have someone that's qualified, and you got burned, like
I've
been
burned on the Neo Sculpt because I had a horrible technician.
Yeah.
Not at Dr. Brett Beber's clinic. So at your clinic, if somebody is coming in for a treatment, because I know you don't have Neo Sculpt, but you offer similar treatments.
Right. So we have radio frequency devices for for the skin changes.
Okay.
And we have soft wave, which is ultrasound for the deeper tissues.
Okay.
And often it's like a layered treatment.
Right.
Yeah.
Just like many things, right? We do Botox, we do filler.
Yeah.
Because they do different things and they treat different areas and have different results. So really you look at the situation, you say, what modalities are going to get the best result for this individual? And for some people, it may just be one.
Right.
And for others, it may be several things that are, including things like lymphatic massage, and which we do a lot of. And we've Ashley, like I'm very blessed. We've got a great team at the office. And
I met Ashley's the one that did the IVs at the cottage, right?
No, that's Madison.
Oh, Madison.
Madison.
Oh,
Yeah.
Madison's awesome.
So Ashley is our medical esthetician, and she does the devices. Madison's our nurse injector. Jen is our front office, and it's great because they're all like super engaged in what they do and they love it. And so I'm really lucky. So when patients come in, they get an assessment, and we along with them first we find out what's bothering them. Right.
Yeah.
That's the most important thing. What's bothering them, and where would they like to be?
It's individualized, which is so nice. And that's it's the best obviously approach, because like what works for you and what on my stomach is not going to be the same.
Yeah.
Right.
Well, and I think also to Brett's point, it's like with a lot of the non-invasive stuff, you have to be patient. Like it's not like a one-time.
It is not,
thing.
and it's not surgery.
Right. It's
like
not
people
surgery.
have to. It's really meant for either in addition to an operation. Let's say you're doing liposuction and you're worried that the skin might be a little bit loose just based on the way their body is. So you'll add that, after the treatment. But it's really important to sort of manage people's expectations, because there's a lot out there in social media that's filtered. Like anything we post, there's zero filter because that's the rule, right? And you want people to. The last thing I want is for someone to see a picture of something that's so over the top that is made to portray something that's real, and they don't get the same result because we've advertised that this is what you're going to get.
Right.
So we try and anything that we post things that are pretty typical results day in and day out of what we do, so that people have a real idea. And we always tell people, listen, and here's people that we've treated that you can see there's very little change. And that's the frustrating thing for both patients and us, that we can't tell someone exactly what the end result will be from these non-invasive treatments. I mean, with surgery, I can show them this is what I'm taking out, and I can tell them within a narrow range, this is the size that you're going to look like. Not the exact shape or image, but you can give people a pretty good sense of what their end result from surgery is going to be. With the non-invasive, you can give them a range, but you can't tell them exactly what it's going to be them.
Is it like the standard of beauty right now of everyone wanting to kind of look the same? Are you finding are people is everyone trying to achieve this same type of look? Because I feel like depending on where you are, I mean,
I think that's the point, right? One, it depends on where you are, and two, it depends on your patient population. So I don't find that in my practice.
Okay.
So I find people coming in at my practice are pretty they're happy with themselves. They want to look like them. They don't generally want people to
notice.
They're happy. They're happy to share, right, with their friends. It's not like they're afraid of telling people that they had X, Y, or Z done, but they want to look like a refreshed version of themselves.
It's like why I got my nose job done, even though I'm the one recording on a podcast. But most people, I didn't want people to be like, oh, that girl went from looking like this to that. I just wanted someone to be like, oh, she looks nice.
Right.
So, I wanted to feel like a better version of myself, not a totally different. Right. And I think that's a really nice, it's nice to know that I feel like depending once again on the city and who your demographic is, it feels like that's really shifting a lot. And it's really hard having young girls doing all this stuff because it just feels like it's all focused on wanting the exact same thing.
Yeah. And it's usually overdone.
Yeah.
I mean, that's one of the frustrating things that in our industry is that if you want something, that someone will do it, whether it's safe, whether it's good,
or they'll go somewhere
someone
else.
Will do it. But I'm comfortable with that. I'm not I know, and people tend to, they talk, right? And they, and people who want a really overdone look know who to go to for a really overdone look. And I'm not that guy.
Right. Yeah, exactly. So that's your own clientele. That's fair.
Yeah.
Are people coming to you a lot now with more, I'm thinking because of Ozempic. I don't know if you're seeing the results of this yet, but I can only imagine the type of weight loss people are now losing. Are you finding people are coming now with so much excess skin because of this, or you're not seeing the results of that?
I wouldn't say to that degree.
Okay.
The patients who come with sort of those really significant amounts, they're loose skin on the arm, those are usually patients who either by diet and exercise and major lifestyle change, or sometimes through surgical intervention have lost significant amounts of weight, 50, 60, 70
and they're
pounds.
just left with so much skin.
Correct. Yeah. And there are but that amount of skin in multiple areas is usually from a weight loss that at least I haven't seen. I've got patients who are on Ozempic, not that I'm not prescribed for them, but patients come in and they you get their full health history. Those patients who've lost weight look pretty typical for someone who's sort of lost the typical amount of weight that people often do with a lifestyle change, rather than sort of the massive weight loss.
Yeah.
But it may be coming. We don't know.
I don't like now that they're on it, I think it's an interesting question.
Well, I just, it's especially go to any of these countries. It's we were laughing when we were in Tulum. You know how you can get all the types of drugs at any pharmacy, and Ozempic is just at the bottom now.
Yeah.
It was Adderall, Ozempic. And I was it's crazy.
Yeah.
And in the States, it's pretty nuts. But
so
what about the face? Let's talk a little bit about the face. I know you do mostly, but because we did a lot of injecticbles now and what's going on there. Yep. That's a big part of your business. Yeah. Okay. So what are people coming in mostly for? And what are people what are you seeing a lot of? What do you?
So again, it's sort of based on your population, your that people that come see you. But I'm seeing more. I'm seeing less is more. People don't want as obvious. So for instance, the lips that we do are to get lips to be a beautiful shaped lip that has volume that fits the face versus lips that, because lips are great. Like patients are thrilled with it. But we don't tend to see people who want the lips that are
And that's
the first thing that people notice.
It is.
And unfortunately, because of social media and everything, people think that if you get your lips done, that's how everybody who has their lips done looks.
Yeah.
And that is definitely not the case. So subtle changes, which is sort of what we're about, subtle changes that enhance beauty rather than looking odd. And we get people who come in who want that, and
I know.
and it's hard to say hard to say no, but I have to, because that's not I wouldn't give them the result that they want, because that's not my aesthetic, and I wouldn't want to treat them knowing that I'm not going to make them happy. Like they deserve to be happy.
And that's also your mark. If someone's like, oh yeah, I got treated by Brett Beber and their lips are literally half the size of their face, then someone else is going to see that and be like, well, I am not going there.
Like it's like anything. It is an artistry. Like you're a doctor, but you have refined certain talents to make it your own practice that, you are very proud to say, these are my patients, these are my clients. Like, this is my artwork. And you don't walk into like any other industry. Like if you're going into an art museum and you want something modern, you're not going to look at something contemporary. Like you're just, it's different
and
strokes
it's different
for different
styles.
folks,
Exactly. Exactly.
And there's nothing necessarily wrong with it. The only problem is from like, obviously a societal perspective, in my opinion, is that just like what's happening is pretty sad for all these like young kids, and what's happening, like even in LA, like you just walk around, you see what's going on out there. It's just the limitations are there's none. So it's just everyone's expecting to look like that. When you were like 14 and you had like this haircut that you wanted, you're like, make me look like Rachel from Friends. But like you look nothing like Rachel. I had like curly Jewish hair.
Yeah, I don't think I ever said that to my
Brett does have a
the person who cuts
great
my
head
hair.
of hair. People actually come in asking for the Brett Beber hair.
No, he said, give me the, what's his name? The David Schwimmer.
Actually kind of looks like David Schwimmer. That's weird.
No, his hair is David Schwimmery.
David Schwimmery? Okay, I have a question about some of the face stuff. So in terms of preventative, like if I'm in my 30s and I want to do stuff to tighten and...
You're 40 now.
Right. I'm just saying, if I was in my 30s, I like just turned 40. I'm like, cuss.
You're 40 now.
So I know there's things like Morpheus, there's PRP,
Right. So
there's all
before
this
we get
amazing
to
stuff.
any of that, number one, sunscreen and hats.
A hat.
I
I have a hat on my car. I really like how I look with this tan.
I know, but there's ways to get that color without actually getting radiation.
I've never seen Brett mad at his kids. The only time I've seen him mad is about putting on sunscreen. Like on vacation when we were in Costa Rica, I remember being in the water surfing, and you could just see Brett from like 50 feet away. He had like UV white. It was like just a white ghost like
Casper.
walking around.
Casper was there.
He really does preach sunscreen. There is no question.
So that's number one. You can spend as much as you want on everything else, but that is for sure number one.
What about being in the sun if you're wearing sunscreen?
Like sun tanning.
Like what about sun tanning? Let's talk about that, because everyone's like, like everyone I know covers their face and doesn't sit in the sun, but me. I like to bake. Me and my mom like to lie out there. We put our stuff on, but like I like to get dark.
Right.
Is that really bad? That's horrible.
Let me give you a short answer. Yes.
Yeah, it's just I'm not going to look good in 10 years.
And it's cumulative, right? So it's not that getting sun once is terrible, but it all adds
going
up.
a few vacations a year sitting out like that, no bueno.
It's really not good.
I know I've been getting little spots.
But we know
on
that there's pigmentation changes. There's photo aging, which is aging of the skin.
That?
That's aging of the skin as a result of UV light. Then there's environmental things, but you can't really control that. The sun is the main ager of the skin, and if you can prevent that, then you're going
this
a
just
long
for some
way.
reason this just clicked. This had never
and
clicked
look at
before in my
Brett's
head.
skin.
Well, I as a kid, like it was like I still grew up in the generation of like dark tanning oil. It smells like coconut. It must be good, right?
I'm still there.
And we got
and he's not learned.
And I got dark, partly because I've got partly Mediterranean heritage.
Yeah.
So the things I'm showing now are not from now. They're from when I was a kid, and that's why with kids especially, and the sun is different now than it was back then.
What
It
would
is
we start
worse.
showing? Like, what would you start seeing? What are people starting to see if they do this? Like sun marks, like little dark spots.
Sunspots, pigmentation changes, the texture of the skin changes in terms of getting a little more wrinkly, less sort of tight.
Oh, yeah, that's what's
I've got
happening
that on my
chest.
chest.
Yeah, so think of people's chests, classic, right? People remember their face and arms, but the V-neck is often forgotten, and that's why that's an area that tends to age
Okay, so when you're doing
faster.
sunscreen, literally for
also
women,
thin-
that's really smart.
It's
I
also
never put it there.
it's
when
also
I'm-
thinner skin to begin with.
Yes.
So thinner skin does ages more rapidly.
Okay, don't forget your neck and your chest.
Okay. Now, in terms
I
of
always forget.
going forward, when there's damage that has been done, so for pigmentation changes, there's things like IPL, which you don't do in the summer because unless you're going to be super diligent with your sunscreen, so that tends to be, at least in our climate, sort of a winter sport. You do it when people are not going to be sort of sitting in the sun, and then if they do go away over the winter, they need to be mindful of that and sunscreened up. In terms of things for tightening, so again, soft wave, which was originally made for the face. That's the radio. That's the that's the ultrasound.
Was that the technology that was made in Israel? Wasn't there one really?
If you look at almost all the technology
It's
that
all
now coming
there.
out, it's all like there's not
Okay.
all, but there's tons that's coming out
Yeah,
of
because there was this
Israel.
one machine that
It's a big biotech and a big center for technology for anti-aging. And so a lot of them are coming out of there.
Cool.
So again, going back to what we talked about before, the trick is finding out what is the problem. And is it the surface of the skin, in which case you're going to treat that either with some sort of, for sure, sunscreen and maybe IPL for pigment, but then ablative things like Viva or a laser to essentially remove some of the layers of the outer skin.
Right.
Peels are also
Yeah.
effective, and there's a lot of skincare now. We get companies coming at us all the time saying sell this, but the line that we use now, we've been using for like 8 years because it works and people
What is it?
generally stick to it. It's the Zeo line.
The Zeo line and what?
Oh yeah, Benji loves that one.
And what is it? It's tell me about it.
So it's people talk about medical grade. What does medical grade
Yes.
mean? Medical grade means not that it has something in it, but it has enough of that something like retinol to actually affect a change. So
any retinol, like any retinol you can buy at Shoppers
at
or over the
Shoppers
counter.
doesn't have enough concentration.
So that's all marketing? What the
Yeah.
fuck?
It's not, the ingredients aren't active enough
they're
to make a
saying
difference.
hydrocortisone is in that, but there's not hydrocortisone. What about
But
for my
the
kids with
rea-
eczema?
So if that's totally different,
Okay.
right? That's totally
Sorry,
different
just checking.
because a 1% of hydrocortisone may be all that they need.
Okay, that's fair.
Again,
but
you should still, if it's recurrent and they're using it a lot, the
that's not- I
pediatrician
know.
and family doctor
Yeah,
should
yeah,
be
yes.
involved.
No, I know.
But there's a lot of stuff that markets itself as including something as an ingredient, but the concentration doesn't need to be enough. And the thing is, they generally aren't allowed to put those concentrations because it can actually hurt people if they don't use it in the right way.
Right. So they can't
So
be
medical
over-
grade is more that it should be supervised, and that it's got enough stuff in it that can actually cause damage, so that it should only be dispensed by someone who's going to spend the time to teach people how to use it properly.
So if you want skincare that is going to actually affect change to your skin.
with certain products, I guess what you're saying. Like he's not saying clean and
Yeah,
clear,
like
saying
mo-
it doesn't have
like a moisturizer
microbeads
doesn't-
No,
in
I'm
it.
not saying that, but I'm saying
with,
like a retinol, like a glycolic, like any of that,
Yeah.
it should be purchased from some kind of
Yeah,
like
or
a,
I mean, listen, people are buying stuff from other countries, and because they can get it, as long as they know how to use it properly and they know what the concentration is, so that they can use it in a way that's safe. And there's information online in terms of what concentration will actually affect a change and that type of thing. So
Wow.
it doesn't mean it doesn't
Like
have different
brands.
components that may be helpful,
right.
right? Put it this way: if it's got a sunscreen in it, then it's better than not using
you
anything,
got it.
right?
Right.
But at the same time, if you really want to see a change, you need a concentration.
Okay,
that's
so
gonna
number
make that
one
change.
is SPF. Number
Right.
two would
Number
be.
two,
Can I guess? It's not water.
yeah, for sure, hydration, 100%.
Sleep?
And I'm the worst. I'm the
You
worst.
are.
I
I'm
don't
pretty,
drink.
I'm
I
like
don't drink
on and
enough
off.
water for sure. But and then there's overall health, right? Doing all the
Yeah.
things that we're supposed to do. And then for skin tightening, so the Soft Wave, as I said before, it was designed specifically for that. There's the ablative things, which can be either a laser or radio frequency. And then, what's funny is in all this stuff, all the new technology, which adds significant improvement to people, the two things that are still the things that can affect the biggest change by preventing negative things is sunscreen, and the other is Botox. So Botox, people think, oh, I've got a wrinkle, I need to. So there's a limit, like to your point about, different places where now people in their 20s are doing Botox. Like at some point you got to say that doesn't make sense. Right. But it's amazing that of all the things from a skincare, sunscreen, and then Botox is right up there with prevention, because if you don't form a line in the first
there's nothing
place,
to take away.
then it won't be there, right? So it's interesting that there are conditions.
Babies are not gonna. It's like gonna be Benjamin Button. Babies, like you.
So yeah, I'm not suggesting that at all. But when people sometimes people come in and say, I want Botox everywhere. And I said, well, why?
Okay, so
and I tell them, like, you may not get a line there for 10 years. It doesn't make sense to do that particular area. But now there's other reasons for Botox, right? Some people, I mean, there's migraines, but I'm talking about purely for the cosmetic aspect of things. When you start to see, the changes don't happen overnight, right? So it's more that people start to see something changing, where maybe there's someone who frowns all the time because they do it when they concentrate, or they do, and now they're starting to see that at rest there's a fine little. That's the time to start in that area, because if you sort of nip it in the bud and start treating that particular area when you're starting to see the changes that could become permanent, that's the time to do it. People, and it's not that you have to treat everything. Some things are synergistic.
Yeah.
Like if you're going to do the forehead, doing what we call the glabella, which is sort of the frown lines between the nose, or the 11s, people call it.
Yeah.
That they're synergistic, so you may do that. But just if someone has no lines around their eyes at all, me personally, I wouldn't suggest them treating that, because unless they don't like the look when they're activating. But most people, that's not the thing that bothers them. But they don't, when they're smiling, I mean, people get smile lines, that's natural, but they don't want the permanent sort of creases there.
But that, I think, is why it is so important to go to an injector, someone you trust, because they would tell you to do something in an area that you would never, like when I get it done, like she put some stuff in my nose. And I was like, it just was more to make it more symmetrical. And I would never be like, oh, can you give me some filler at the top of my nose? It's so odd. But just based on how it all kind of sits and the way that I guess my nose is settled with my nose job. And like, I was just like, okay. And I fully trust her, and no one would know. I mean, everyone knows now. But like, it was just like, I really trusted her to do that. And it made my face look more symmetrical. But I would never have known to advocate for myself and say, can you please make sure that my face looks like she was like in your chin. Some people get a little bit in their chin to even it out. But you're not able, you really need a trained eye, was what I'm saying, to get a natural and symmetrical look.
Yeah. And someone who's gonna say no.
Exactly.
So, oh, I need a bit here. And like, no, you don't.
So I have a question, Brett, about like the face lasers that you can buy online, like those masked handheld ones that you can use at home, because now there's so much on the market. I feel like everyone on social media is pushing those. Do those actually make a difference, or are they a waste?
I don't know, to be quite honest. Like, I certainly haven't seen any patients who've told me that they're using that I've seen a significant difference.
Right.
And again, I think it probably depends on most places that are regulated, like Canada, things have to be safe, right? And so, but there's some parts of the world where safety is less of an issue, and they'll manufacture things that people, again, just like the concentrations in skincare, they may manufacture some of that really can make a difference, but isn't necessarily meant for home use, right? So, I don't have a lot of experience I don't have any experience really with those home kits, so I can't really say.
Okay.
But I think part of the problem is that it is now, especially with the commoditization of social media, it is something that there's lots of things, forget just sort of, cosmetics and stuff. There's a lot of stuff that's being pushed because it's now a profitable, a streamline of income for people, and they're their popularity and notoriety allows them to have a platform to suggest things where that may or may not sort of be valid.
Right. So be careful what you are purchasing
Yeah.
based on who's pushing it. I know. I think that's also.
Yeah. Oh, for sure. I don't believe anyone anymore.
Well, that's a confusion.
I just think everyone's saying that because it's paid.
Well, and it's confusing. I mean, I get messages because sometimes I'll try like a multi or like a new vitamin or something, and people will be like, have you tried Array? Have you tried Seed? Have you tried, like, there are so many things that claim to be so much that so many influencers are pushing. And it's also with lasers too. So I think that's just why it's confusing for people.
Yeah. And people often don't know that there isn't, when it comes to these devices, there isn't the rules with those are very different. Like anyone can buy a laser.
Right.
I mean, part of it's up to the companies to discern who should sort of have it, but
trained to use it.
And don't get me wrong, there's lots of med spas that do a good job and are safe, but everyone has a story about going to somewhere and or a med spa that was down the street, and they may not have the qualifications to do it, or they may have the certificate, but they really just
are trained or
aren't and their motivations may not be safety first and then everything else afterwards.
Right. So go to someone you trust or word of mouth. I think that's the biggest thing, right?
Yep.
I do have one last question because I think this is a big topic for a lot of people is cellulite.
Mm-hmm.
I've actually gone for a treatment with you guys and I forget what it's called, but it made such a difference.
Really?
Yes.
Yeah.
I had to do, so this was one of those things I had to do 10 sessions, 1 week apart. It was a commitment. You guys were like, we cannot guarantee sort of,
Front and back. What was it?
So it was more back. Again, it was like, I went in, they took pictures. It was like, what is your area of concern? And I was like, the back of my thighs and my bum. And the before and afters, like, are actually.
I want to see so badly.
I'll post them. I actually don't care. No, Madison has them, and it is
post that shit.
It's a little bit not embarrassing, but it's like
embarrassing. That's amazing.
No, it is for sure. Anyways, it's like of my bare butt.
So cellulite has been the thing that we can. For a long time there was nothing, and then things have come up, and the treatment that you had is a radio frequency device that we have, and it targets, again, I talked about things being tunable, so that targets deeper.
You're right,
it's not a one-off type of treatment, which SoftWave kind of is. So SoftWave for skin, for tightening, that's one of its benefits, that it's sort of a one-time treatment, like once a year type thing. But a lot of the technologies, it's slow and steady wins the race. And so that device works really well for that, but it does not eliminate it completely. You can tell everyone yourself, it's a lot better, but it's not gone.
Yep.
And people have to decide for themselves how, and again, it's frustrating for patients because it's a lot of your time invested to come and do it, right? It can be 8 treatments, it can be 10 treatments, you just never know. But it does improve. And the other frustrating for both myself and patients is that because it's a prolonged period that you have them done over, it's like watching your kids grow. Someone turns to you and says, oh my God, your kid got so tall. And you're like, really? You don't notice it because it's gradual. And then you measure them and you're like, that's 2 inches.
Yeah.
So because the results from the time you start to the time that you end take a long time, it's often it's only after the final photos and people look and they're like, holy smokes, look how great that is. And look what a change it is. But on the day to day, they're not looking at it going,
see a huge,
it's not a tummy tuck. It's not a breast augmenter lift, right?
Because they
were shocking.
And they're critical because not only for patients to see, but for us to say, what are the results we're getting? What can we tell patients in terms of what a result will be for them and the average? Because you want to communicate that with people so they can decide.
You've got to manage their
the only way people can choose if there's something is right for them, whether it's surgery, non-surgery, whatever it is, they have to be able to understand all of the ramifications so they can make a decision for themselves. And I don't sugarcoat the negatives. So because I would much rather someone say, you know what? I know that I'm a very sort of, my thought process is that if I don't know what the result's going to be, I'm not comfortable with that. And if that's how they are, then I'd like to know that ahead of time so I can tell them that's really good because this probably isn't for you.
Or creams don't work, do they? Let's be honest. No.
Because they don't penetrate deep enough to do.
All right. No cellulite creams.
Okay, well,
Wear
now-
your sunscreen, drink water, get sleep. Ugh.
It's everything everyone's told you when you were a kid. And those are the biggest.
I'm a little bit annoyed about the sun thing.
Sorry.
Okay, it's like good. I've never even just thought. I've just always just been like, there will be a day. Like I see everyone on vacation. Every woman around me is wearing a hat, hiding under an umbrella. And I'm like, I'll take full sun.
And we haven't even
time.
we've talked all about photo aging and the negative appearance changes that it makes, but we haven't talked anything about skin cancer and the rise in that the people who are doing it the best are the Australians, because they essentially have had a Northern European population move to a tropical area, and over generations they've seen huge numbers of skin cancers and melanoma as well. So they've got public health campaigns where if your kid doesn't have a hat on and sunscreen, people will chastise you. Like if you take your dog for a walk and you don't pick up after them, people will now say, no, why didn't you pick up after your dog? Like it is now part of the culture.
That's amazing.
In a great way.
That
is really good.
We're not there yet.
Yeah, I know. I'm
gonna go home, lather my.
Lanny's definitely not there.
Lanny is definitely not there. She's gonna throw out her tropic sun.
I'm like, when I was in Australia, I felt like it wasn't that bad. Anyways, 40 years ago.
So also, if you want to see Dr. Brett Beber in action at his Holly Street Clinic in Toronto, he is having an open house on Wednesday, September 20th. Lanny and I will be there.
Yeah. Do you need live demonstrators?
Yeah.
No, honestly.
Speak to Madison.
Maddie. Oh my God. I want to be the new, what's it called? The soft wave.
Soft wave will be
so tell
there.
us about
Yeah,
this.
tell us what's going to be there.
What's going to be there.
So yeah, it's on September 20th, and we're going to be talking about mostly regenerative technology. So soft wave, we're going to be talking about. We'll also talk about exosomes, which are a hot topic now, which we didn't talk about today, but it's exciting regenerative technology that can be combined with multiple therapies, including microneedling.
Ooh,
and we're also going to be talking about lymphatic massage and other technologies that really are becoming sort of main parts of regenerative care.
Okay.
Amazing. So new face and body technologies. Lanny and I are willing to be guinea pigs. Come watch us get
I'm here for
butt
it.
PRP.
I'm not sure we're going to be doing live stuff, but we'll certainly be.
Wait till we talk to
talking about it.
Madison.
Okay, so September 20th, Holly Street location, Dr. Brett Beber. Thank you so much.